My name is Kristen Rodriguez, and this is my Module 5 assignment for Adult Health 1 with Professor Tovar. The visual system is composed of two structures, and they are the internal and the external structures of the eye. The external structures are the eyebrows, eyelids, eyelashes, lacrimal system, conjunctiva, cornea, sclera, and the extraocular muscles. The internal structures of the eye are the iris, lens, ciliary body, choroid, and retina. The sclera is commonly known as the white part of the eye. It's made up of collagen fibers, which provide protection for the eyeball. The cornea is a thin dome-shaped tissue at the very front of the eye, and light enters the eye through there. The light continues to pass through an opening called the pupil, and it's that little black dot that we all see in everybody's eyes. The pupil is surrounded by the iris, which is right here, and that's the color part of the eye. The lens is a transparent structure that works with the cornea to bend light and focus it onto the retina, and it's located in the back of the eye over here. And the ciliary muscles, which are right here, these little bumpy guys, they are attached to the lens and they help to change the shape in order to focus at various distances. The retina is located here in the back of the eye, and it's light sensitive, and the tissue lining is thin. And the optic nerve is a bundle of nerve fibers that serve as a communication between your eyes and your brain. A common eye disease in adults is cataracts. As we age, the lenses in our eyes become less flexible and they begin to get cloudy. And sometimes it covers the entire lens inside of your eye. And basically, it can cause blurred vision, poor night vision, and colors may not be as vivid as they once were. So common treatments for cataracts are lens replacement surgery, and that removes the cataracts, involves a small incision through the natural lens, and then it's replaced with a new lens. Another eye disease is known as RP, or retinitis pigmentosa. It is a genetic disorder that can slowly damage the rods and cones and can eventually cause blindness. The symptoms of this disease depend upon whether the rods were first affected or the cones, but it is most commonly affecting the the rods initially. Peripheral vision and night vision are affected due to the damaged rods, and the loss of color perception and central vision depend on the damage to the cones. Treatments for RP include gene therapy, stem cell therapy, and visual prosthetics. Another common eye disease in adults is dry eye syndrome. Dry eye syndrome is the result of a lack of sufficient moisture on the eye surface. This can result in insufficient tear productions or poor tear quality. Some underlying causes and symptoms of dry eye syndrome are burning sensation, gritty or sanding feeling in the eye, sore eyes, blurred vision, or watery eyes due to excessive tearing. Dry eye management and treatment options include eye drops, medications to reduce inflammation, dietary changes, hygiene of the lids, and also some small in-office procedures. A common eye disease in the elderly is age-related macular degeneration. This primarily affects the macula, which is a tiny portion found at the center of the retina, and it's what helps keep the vision sharp. Some of the factors that stand out with you're increasing your odds of AMD is age, race, family history, and smoking. And it comes in two types, dry and wet, but each requires a different treatment approach. The treatments can include certain medications, therapies like photodynamic therapy, and low vision rehabilitation. Another eye disease that can often affect the elderly is glaucoma, and that's a collective term for a group of eye-related disorders that damage the optic nerve. So, glaucoma is diagnosed through comprehensive dilated exam, and treatment is often aimed at reducing the amount of fluid in the eye or increasing the amount of fluid that drains from the eye. Sometimes with glaucoma patients, surgery may be recommended to increase drainage flow. One more common eye disease that is found in the elderly is known as diabetic eye disease, or also known as diabetic retinopathy. And it's basically an eye disease that comes from diabetes, and it damages the blood vessels in the retina, and it causes them to either bleed or leak fluid. And if it's not controlled, it can cause permanent damage or vision loss. If you have early stage diabetic eye disease, you can control it with controlling your blood sugar and your cholesterol levels, but advanced stages of the disease often require surgery. Nursing management for common eye diseases include promotion of health maintenance, including balanced diet, exercise, and avoiding smoking, encouraging regular eye exams, providing education on proper eye care, including glasses and contact lenses, also encouraging prompt treatment of any eye infections or anything that you may think might be an infection. Also encourage the use of protection of eyewear when appropriate. For example, sunglasses, or if you work in a factory, to wear goggles when necessary.